I'm Dr. Charles Balch. I'm a professor of surgery at the University of Texas Southwestern Medical Center in Dallas, Texas, USA. Well, as we've mentioned this morning, there are two really breakthrough strategies in the management of melanoma. The first is we now understand some specific mutations for which identify patients that we can target to give a specific therapy that blocks the ability of those cells to grow, and therefore they die off. Survival rates are much better with oral therapy given together. The second advance is a form of immunotherapy, which is really cool because this form of immunotherapy doesn't attack melanoma cells directly, but in fact enhances the ability of the immune system to recognize melanoma as a foreign invader, just like it would for a bacteria or a virus, and in doing so can eliminate thousands or millions of cells that are present somewhere else in the body. Now, the analogy that we made in our session this morning was kind of a sidebar to have people understand tolerance and these so-called checkpoint inhibitors. And the sidebar is, if you look at a person who is allergic to grass, they go to an allergist and they get small doses of grass in order to make them tolerant so they won't be allergic and react to grass. And so too, we've now learned that melanoma, and maybe other forms of cancer as well, shed small amounts of tumor proteins while it's growing. And in doing so, paralyze the immune system, which we call tolerance, so that it's unable to recognize and react to melanoma as a foreign invader. So these new drugs, for which there are several, are what's called checkpoint inhibitors. In a lay language, they take the brakes off or unblind the immune system to all of a sudden now recognize melanoma cells as a foreign invader and kill them with the body's own innate immune mechanisms, even though they may have thousands or millions of cells. So it's a very important form of therapy alongside targeted therapy, alongside surgery, that give us a lot of hope for present and future melanoma patients.